Hello, Ali. How are you?
I'm good. How are you?
I'm fantastic. So great to have you here for the second journal club for the 2025 IFFGD Wellness event. IFFGD really appreciates your hard work and all of your dedication to the organization. And so while Ali gets his screen set up, I just want to introduce everyone to Dr. Rezaie. He is at Cedars-Sinai Medical Center in Los Angeles, California, and is a very dear friend to the foundation. Many of you may know that he was the chairman of our Norton Educational Series event in 2023 on the microbiome. If you haven't seen those videos, they also are available on our YouTube, and you get wellness points if you watch them. He has been author of many of our fact sheets and has been a source of help for me when I have questions about things, and definitely a friend for patients. We were thrilled that he agreed to do this journal club today, and I'm happy to announce to everyone that actually Dr. Rezaie was voted in as a member of our advisory board by the board of directors at IFFGD just this month. So congratulations on that. We appreciate all your support and look forward to working with you more in the future. So as you were told when we started, this meeting is being recorded, and so that we can post that for other people who aren't able to join. Dr. Rezaie, I'm going to turn the floor over to you. As I do, please remember we do have a chat feature, and feel free to put any of your questions in the chat so that we can follow up with those at the end of Dr. Rezaie's presentation. So today he is reviewing an article that he was last author on called Elemental Diet as a Therapeutic Modality, a Comprehensive Review. And we're really excited to hear about this. And perhaps since we have patients on the call, Dr. Rezaie, you can talk a little bit about systematic review and why it's important as you talk about the article itself. 25, I see it. There we are. We see your PowerPoint now.
Okay, good. I'll
Great.
start. I won't touch anything else. All right. Do you hear me still?
We do. Perfect.
Perfect.
Thank you so much.
So thanks for having me, and I'm very excited to present this paper for you. I think this highlights a few things going over this data, because first of all, it shows the power of diet and how we can utilize diet as a therapeutic modality, and even as even a diagnostic modality, as based on the response that patients have, and the fact that how much well we can do on diets. Considering that elemental diets are not a new concept. They have been around since the 70s, when they were contemplated as a modality for astronauts to eat in space and produce very little stool, because having a bowel movement with no gravity is no fun. But that's how it started. And look at it now, after decades, it continues to improve, continues to sort of like show us how we can make differences in people and different diseases with diet. So before I get into it, I just quickly go over digestion. Obviously, we're not going to go into a whole lot of detail, because that's going to be another talk all by itself. But if you think about it, the main food ingredients that we eat outside of vitamins and minerals are the carbohydrates, lipids, and proteins. And I'm not talking about fibers, so I'm talking about the digestible components of food. So carbohydrates, they start being digested actually starting in the oral cavity, and they go through the esophagus, stomach, go through multiple paths of digestion, and finally in the small intestines, pancreatic amylase starts to break down the carbohydrates to a point that they get to the intestinal mucosa, the lining of the bowel, and then that's where the brush border enzymes break it down into monosaccharides, and it gets absorbed. So these pathways can be affected in multiple ways. Sometimes enzymes can be missing. Sometimes the cells that contain those enzymes can be depleted. And there are so many things that can go wrong in these pathways. The same goes with lipids. Lipids start some small amount of digestion in the mouth, but the main part is in the stomach and then subsequently into the in the small bowel with bile and pancreatic enzyme, and eventually diffusion into the cells and getting into the lacteals. And this process also is very complex, considering that lipids are hydrophobic, and we are mostly water. So absorbing something that is hydrophobic into a hydrophilic environment is not an easy feature, but our bodies have figured that out, and that is through fat droplet and micelle formation that happens with the bile acids. And also proteins. Proteins, as we all know, are a combination of a bunch of amino acids on top of each other, right? So, and as they break down and get digested by numerous different enzymes that we have, they break down into amino acids and eventually get absorbed. So this process, hundreds of the different pathway points, and they all can go wrong. But what if I can tell you that we can bypass these steps outside of giving the patient total parenteral therapy, right? So how can we do this without um, uh, doing the parenteral nutrition for the patient? We can do it through enteral nutrition. So if we go through the absorption as a snapshot, we can see that we absorb a whole bunch of like protein, fat, and water throughout the day, and we're relatively efficient about this. But one important thing to remember is that even if we don't eat, there is still a constant flow of nutrients throughout our gut. And that is because of the epithelial sloughing, because of the bowel secretions, right? So the lining of our bowel continuously is renewing. Almost, for example, in the small bowel, every 5 days, almost all the epithelial cells renew. So those cells die and fall into the gut lumen, and that actually provides significant source of energy for our native gut microbiome, and it's very important. And that's why, for example, if somebody is not eating at all, that doesn't mean the microbiome is starved to death, because there's still some flow of nutrients to the microbiome. Having said that, the invasive bacteria and overgrown bacteria, archaea, or fungi have a hard time coping with that situation, where it's called fasting, where the flow of the food is not there. So that's important because I'm going to show you some of the effects of elemental diet that can be only explained through this pathway. Also, remember, the digestion doesn't come free. About 20% of the energy that is spent per day goes into digestion. So that's a lot of energy that we use to break down food. And that is why when we use elemental diet, for example, we save a lot of energy, which is very important in certain group of patients that we're having a hard time catching up with the calorie intake. So it's important to know that prolonged fasting is not a new concept to mammals. As we know, the bears and a lot of Arctic mammals do hibernate, and this hibernation leads to significant changes in the body function. This is actually a very interesting study that was done in Sweden, I think, or Finland, where they got stool from bears that were just waking up from hibernation and from bears that were going to hibernate. Obviously, at those 2 points, bears have a completely different body metabolism, right? When they wake up, interesting enough, how microbiome is healthy and happy. even though they have been sleeping for 4 to 6 months. And if you take that gut microbiome and give it to the mice, they will have a normal body fat gain and normal glucose metabolism. So it's quite a healthy sort of microbiome. On the other hand, as they were eating everything that they see in their path and they're ready to go to sleep, that microbiome changes in function. And if you give that microbiome to mice, they start gaining a lot of fat. So that shows you how fasting is important in the health of our gut microbiome and regulation of our gut microbiome. And one of the points that the elemental diets work is for induction of this pseudo fasting, i.e., the food getting absorbed at the beginning of the small bowel and the rest of the gut doesn't see food, and it kind of mimics the hibernation / fasting environment without actually fasting, which is one of the important points of elemental diet's function. So elemental diet composition has evolved significantly over the last 50 years. Originally, they used to have small peptides. Now, generally for the nitrogen source, they have free amino acids. And now they mostly have MCT oils. They used to have long chain triglycerides or like full on, for example, safflower oil or olive oil, depending on what plant-based oil that they were using. And these are mainly because it was not feasible to do this about 50 years ago. Making free amino acids was not cheap. And in fact, in some cases, it was not possible to mass produce free amino acids 40, 50 years ago. And in terms of carbohydrates, they have monosaccharides or easily digestible saccharide polymers. What does that mean? That means that these are carbohydrates with very short chains, and they easily break starting in the stomach. So they break down into monosaccharides and they get absorbed. The classic example is maltodextrin, which is commonly found in a lot of the foods that we consume these days. And also dextrose and glucosammaltose are the most common monosaccharides that we use in our foods these days. So what is important is that elemental diets are very low fat, meaning that about only 6% of the calorie is coming from fat. And they are high carb actually, but the carbohydrate comes from the monosaccharides and normal amount of proteins. But the proteins come from free amino acids, and they're 100% absorbable, so they all get completely absorbed. So by definition, they're very low fat, high carb diets. So this is essentially how we think the elemental diet works in different disease states. I'll start from the top left. So because they don't have proteins, they are allergen free. Remember, essentially almost all allergens are proteins. So if when the elemental diet doesn't have any proteins and it's all amino acids, it cannot produce any allergic reaction. So that's why it works really well for eosinophilic esophagitis, eosinophilic gastroenteritis, or any other disorders that type 2 inflammation has a role. Elemental diet can be potentially utilized. Another important thing about the elemental diet that we already touched on is the fact that elemental diet gets absorbed at the first few feet of the small bowel, and the rest of the small bowel remains sort of free of food, sort of, and only the sloughing of the bowel and also bowel secretions go through. So the proximal absorption is very important, and it leads to low fecal bulk. So the amount of stool that you would produce on elemental diet is significantly less because the majority of the diet gets absorbed. So that's why we use it in short gut syndrome. We use it in small intestinal bacterial overgrowth, intestinal methanogen overgrowth, and also we use it in gastrointestinal fistulas, especially in the setting of Crohn's disease that we use it, and also chronic pancreatitis. As we discussed, it's a low-fat diet. So for disorders that you're having a hard time dealing with high fat content of the diet, and it's very helpful. So classic example of that is chronic pancreatitis, which we'll touch on the data. Also, they don't have any food additives, right? So one of the reasons that we think for enteral nutrition, patients with IBD get better is because they're not getting all the partially, unhelpful or unhealthy food additives that we have in our diet. That gets eliminated. So that potentially is helpful. There is no artificial sweetener, there is no coloring, there is no sort of microplastics. So that kind of like helps with the health of the gut as well. Microbiome modulation, we're going to talk about that. That's why it works in, again, IBD and SIBO. And also it has optimal absorption efficiency. Essentially, pretty much everything that you take when you take elemental diet gets absorbed. And also a lot of times our patients or even healthy subjects have a subclinical micro or macro nutritional deficiency. And because elemental diets have all the minerals and vitamins that you need along with the amino acids, it fills your tank up for absorption of these components. And also, it helps with the mucosal permeability. The reason why we think this happens is because of the amino acid content of the elemental diet, which are integral and critical for the health of epithelial cells and growth of the epithelial cells. That is one of the reasons that, for example, in chemoradiotherapy-induced stomatitis, amino acid compounds or elemental diets are very helpful, because in that situation there is significant turnover of epithelial cells, and giving the building blocks of epithelial cells, which are the amino acids, will help. And also the decreased pancreatobiliary stimulation, because there is no ultra branched carbohydrates or heavy duty sort of proteins that needs energy to break down, along with big time lipids to be broken down. Now, if this is this good, why are we not using it? Well, there are multiple limitations, right? Palatability is a big problem. Amino acids by themselves are not palatable at all. A significant proportion of them have a lot of sulfur, so if you taste them individually, they taste like rotten egg. So palatability has been an issue, to a point that about almost half of patients can't tolerate them, even in the setting of clinical trials, which is a problem. And as we will discuss with food engineering, this is resolving. Another issue is access. A lot of times the enteric nutrition is not covered by insurance, which is an issue. And another issue is cost, right? So it used to be extremely expensive, because making all the free amino acids one by one and mixing them together, it's not cheap. But that is also improving, and the cost has significantly decreased over the last few years. So let's talk about the individual diseases and see what is the data of elemental diet systematically on these disorders. Let's talk about intestinal microbial overgrowth. And these are disorders such as small intestinal bacterial overgrowth. Those are the ICD codes for them. Small intestinal fungal overgrowth, SIFO, and intestinal methanogen overgrowth, IMO, when they are archaea overgrowth. So generally, they're diagnosed with breath testing for SIBO and IMO, but small intestinal fungal overgrowth is only diagnosed by small intestinal aspiration. So the way we treat these, first we look for the modifiable underlying cause. For example, if there is something that is affecting the gut motility and it can be taken away, we try to take it away. For example, narcotics. Whether we stop the narcotics or we used a partial mu receptor antagonist to antagonize the effect of narcotics on the gut. Or if the small bowel is inflamed, for example, in Crohn's disease or celiac, obviously we want to control that so the motility improves. Having said that, that's not usually available, and so many times the underlying cause can't be figured out, or it's not modifiable. So then you're left with induction of remission, which can be with antibiotics or elemental diet, and also maintenance of remission, which can be with low fermentation eating. It can be with migrated motor complex modulating drugs such as erythromycin, prucalopride, i.e. Pro-motility drugs, or it can be replacing one meal a day with elemental diet, usually the breakfast or the dinner. So we're going to talk about the data on the elemental diet. When this paper was written, this was only available in the abstract form, but now it's fully published, this paper. So this is a study that 30 patients with SIBO or intestinal methanogen overgrowth or EMO or both were treated with elemental diet. First, they had 7 days of screening, then they were followed for 14 days, and then 14 days of a follow-up after they reintroduced the regular diet. And they were on their daily symptom profiling, and they gave stool at the beginning, after elemental diet, and also at the end of the study. And they did breath testing, they did urine tests, saliva, and blood tests. So in a nutshell, because this was a palatable elemental diet, 100% of the patients could finish 2 weeks of exclusive palatable elemental diet. So we didn't see the usual 15 to 45% dropouts in the non-palatable elemental diet trials, which was a good achievement. In terms of breath tests, which I'm going to show you some data, 73% improved, 83% improvement in the symptom profile, and also significant improvement towards beneficial bacteria increasing and harmful bacteria decreasing, such as Fusobacterium and M. smithii. These are the baseline sort of characteristics of these patients. If you want to apply the criteria for IBS, about 17% were IBS-C, 57% were IBS mix, and about 13% were IBS diarrhea, and 10% functional bloating, and 3% functional diarrhea. One important thing is that these patients, 26 out of 30 of these patients, had already been tried on antibiotics, other elemental diet, plant-based antibiotics, and also pro-motility drugs. So they were not treatment naive. They already had failed a lot of treatments. And not surprisingly, when you make the diet more palatable, patients preferred it, and whether in terms of appearance, smell, taste, aftertaste, or consistency, which are the cardinal components of taste. And not surprisingly, this translated into more tolerance of the diet. Now, this is interesting, and it goes back to the fasting sort of concept that I was talking about. If you look at the red solid line, that's the breath test hydrogen production before the elemental diet. As you can see, within the 90 minutes mark, it rose roughly from less than 10 all the way to a plus 40. So a significant rise in these patients with SIBO and also EMO. So after the elemental diet, as you can see, the dashed red line, it significantly decreased, and it did not reach the plus 20 part per million that we usually consider positive for small intestinal bacterial overgrowth. But it continued to rise. It's just that it shifted from a small sort of intestinal fermentation pattern to a normal colonic fermentation pattern, which again tells you that unlike antibiotics that affect both small bowel and the colon, elemental diet doesn't go and wipe out all the bacteria or decrease significantly the colonic bacteria. It essentially affects this small bowel fermentation and the bacterial overgrowth, which is promising. And from the Methane, similar sort of findings. So methane all throughout was high before the study, but after elemental diet it dropped, but it didn't become completely zero in all of the patients. And again, that goes to fact that we all have a little bit of a archaea, and it's just that when it overgrows, that's where the problem is. Another thing that we did in this study was that instead of relying on the recall of patients at the end of the day on how the stool looked like and how many bowel movements they had to take pictures of their bowel movement, and this, based on AI, would tell us what is the stool form. And we cumulatively had 1,400 bowel movements, and we analyzed the data. And not surprisingly, we saw that the number of bowel movements dropped during elemental diet. Even though, as we will see, it became looser, the number of bowel movements decreased. But one very interesting thing that we saw is that, not surprisingly, in these patients, at the beginning of the study, the majority of the patients had incomplete bowel movements. Roughly 60% of them had incomplete bowel movements. But about 1 week into the elemental diet, that increased, the complete bowel movements increased from 40% to 68% and continue to stay high. So we saw a 30% improvement in completeness of the bowel movement, because a lot of times these patients complained about sensation of incomplete evacuation, and this significantly improved after elemental diet. And interesting enough, after they reintroduced regular diet, that did not significantly drop, continued to stay high. So it doesn't look like it was a placebo response, because if it was a placebo response, this should have start to go down after we stop the elemental diet. This is the Bristol stool scale determined based on AI. And as we saw, is that during the screening, the significant proportion was still falling within a normal form of stool. But that actually became a little bit looser, and that's known with elemental diet. But as you can see, after we stopped the elemental diet, the number of normal bowel movements continued to increase to a point that pretty much, except for a few patients, bowel movements were within the Bristol school of 3 to 5, 2 weeks after the elemental diet, which again was a positive thing to see. There seems to be some lasting, and if anything, some improvement in the symptoms even after you reintroduce regular diet. So these are the improvement of the symptoms right after elemental diet. But as you can see, some of the symptoms continue to improve at 2 weeks into the regular diet. And this included brain fog, constipation, urgency, fatigue, flatulence, diarrhea, distension, and bloating, and discomfort and pain. Belching did not appear to be significantly changing, which is interesting. It's probably because of the years of bacterial overgrowth. This is a learned behavior, and it will take probably longer to improve. Even though it was minus 18%, that did not reach a statistical significance. But there were some improvements that was seen even beyond the elemental diet 2 weeks into the regular diet. For example, a good example of it was urgency, that it improved even further, and also brain fog that improved even further after that, which is curious how that worked, probably by restoring the baseline and native gut microbiome. And we saw some improvement in the gut microbiome as well, to a point that, for example, we saw that Fusobacterium continues to drop even after reintroduction of a regular diet, which again can be potentially explained by the fasting effects that we have seen in other mammals, that when native bacteria now takes over, doesn't allow the other invasive one to overgrow. So essentially now that you have a green lawn, doesn't allow the dandelions to grow back. And this kind of like matches the findings that we saw that with the hibernating animals. We also looked at other components of gut microbiome. We saw that the Candida albicans significantly dropped. And also the archaea significantly dropped. And we further looked at archaea to see whether they stop producing methane or they actually decrease in load. And in fact, they did decrease in load, and that's what we saw in the stool of these patients that we saw before and after the elemental diet, and even 2 weeks after reintroduction of regular diet, that the archaea continued to stay at a normal level and they decreased from the baseline. There were some surprise findings as well. We knew that palatable, not just palatable, even non-palatable elemental diet leads to some weight loss when it's taken. So for this reason, we checked for a visceral fat and also the total body fat in these subjects. And what we saw is that the majority of the weight loss was because of the fat loss, and there was a 10% drop in visceral fat, which is an interesting finding. So now healthy control studies are ongoing to see what is the mechanism underneath fat loss with elemental diet. In terms of adverse events, no serious or adverse events were reported. Mild adverse events that were seen was diarrhea in 3 out of 30 patients, cramps 2 out of 30, nausea about 4, heartburn, fatigue, urgency, belching, and transient hemorrhoidal bleeding. None of these led to discontinuation of the study, but these are things to keep in mind that may happen when you start elemental diet. And none of them required antibiotic therapy. Now, how about other fields? So chronic pancreatitis is another field that elemental diet has been tried. So the main issue that we have with chronic pancreatitis patients is pain, and abdominal pain. That's is very hard to treat in patients. Now, there was this large study that was done in Japan with almost 600 patients in 266 centers. And what they did is that they replaced one meal a day, 300 to 900 calories, with an elemental diet. And what they saw is that a very nice drop in the amount of pain that these patients were experiencing, and almost getting to the optimal level at 4 to 8 weeks. And this continued to sort of maintain all the way to 12 weeks of the study. And whether patients were on narcotics or not on narcotics, the response was the same, and response to abdominal pain and discomfort were very similar. So almost a 60% reduction in pain. There was a second study, a smaller study with 17 subjects that was done, and they also saw a 60% improvement in pain. And in fact, 60% of the patients became pain-free at 8 weeks. Having said that, at the beginning, these patients, the majority of them had grade 1 pain. So they were not severe pain, they were mild to moderate bout of pain, 82% of them. But nevertheless, almost two-thirds of them had a pain-free status at the end of the trial. So in these studies, it's not exclusive, meaning that patients did not take only elemental diet. These studies utilized replacing breakfast or dinner with elemental diet, and it's interesting that elemental diets can show their effect even with replacing one meal a day. How about Crohn's disease? Again, this has been going on for many years in terms of the data, and goes way back, even late 70s. There was some data on this before the biologic era. And right now it's making a comeback, not just elemental diet, essentially exclusive enteral nutrition is an acceptable modality to treat IBD patients. And if you look at the data, the rate of remission that you can induce with elemental diets or enteral nutrition almost matches steroids, which shows how effective they can be. But the issue becomes after that, how do you maintain sort of maintenance and response to therapy, which you need some sort of maintenance therapy for these patients. And non-compliance rate in these trials were 40%, not surprisingly, even if you wanted to give it with an NG tube, still compliance was not that good, and it's not easy to implement that. Now, with the more palatable sort of diets, this is obviously improving. And this is not just to go through this, but this is essentially summarizes how you do the systematic review, going back all the way to studies that was done in 1984 to the more recent studies and more. But if you look at all these studies that were done with exclusive elemental diet, somewhere between 2 to 8 weeks, pretty much all of them showed positive results in terms of response. The majority of studies were done on Crohn's patients. There was one small study on pouchitis, and no sort of formal study on except for this study on ulcerative colitis. So that's the majority of the data in IBD is on Crohn's patients and not necessarily on UC. And it's already in the guidelines that you can consider, obviously, enteric nutrition, exclusive enteric nutrition for treatment of Crohn's disease. In eosinophilic esophagitis, not surprisingly, this also works, and it has been associated with the highest rate of remission that we have seen with any other modalities, even as compared to biologics. And the pooled histological response in elemental diet is about 91%. And it's very effective in these patients. And it decreases the eosinophils, it decreases the mast cells. So histologically, it improves things. Endoscopically also improves symptoms. And there are several studies, again, in this field that shows both in adults and also children that elemental diet is effective in patients with eosinophilic esophagitis. And this goes back all the way to a study done in 1995, and that's pretty much where the disease was in fact defined. So people have used this to treat eosinophilic esophagitis from at the beginning. Also, not a common disease, but eosinophilic gastroenteritis is also responds to elemental diet. This is a very tough disease to treat. This was done on 15 patients and 6 weeks of exclusive elemental diet. And not surprisingly, it led to significant improvement, both in terms of symptoms, in endoscopic findings, histology, and it was pretty well tolerated among these patients. In terms of celiac disease, well, this is a gluten-free diet, but I mean, even polymeric diets can be gluten-free. But interesting enough, with some of the complications of celiac disease, such as dermatitis herpetiforme, which even if you go on gluten-free diet, you may not respond in terms of skin diseases associated with celiac disorders. People have tried this on very small studies, and this study was 8 subjects, and they have shown some improvement in skin findings of patients with celiac disease, i.e. dermatitis herpetiformis. And also in refractory celiacs, type 1, this is when patients don't respond to gluten-free diet and an abnormal lymphocytic reaction is starting to form, and not necessarily similar to type 2 that is potentially a precursor for lymphoma, but these are tough patients to treat, and elemental diet was successful in these patients. How about non-GI disorders? There has been some data on disorders such as asthma, eczema, but there is a study, which a controlled study, very small study, in rheumatoid arthritis with 30 subjects, that it appears that at least in this short study within 6 weeks, that the efficacy of elemental diet in rheumatoid arthritis is similar to prednisone. Having said that, we don't have a longer study, but it's an interesting concept that even a non-GI related inflammatory disorder does respond to elemental diet, and again underlines the importance of diet in not just gut-related inflammatory disorders, in all inflammatory disorders, and the fact that there is certainly some significant importance to diet and anti-inflammatory diets that still needs to be figured out in these conditions. So I'm not going to go specifically into detail, but other conditions that people have considered this is asthma, atopic dermatitis. We talked about it, pneumatosis intestinalis, and also prevention of chemoradiation, oral mucositis. This is a big problem when we do chemoradiation. When stomatitis and inflammation of the lining of the mouth occurs, extremely painful, eating becomes a problem, and the elemental diet supplementation or amino acid compounds have been helpful in these subjects. And also, it has been used in a small bowel obstruction. There are several conditions that, unfortunately, patients have recurrent bouts of bowel obstruction. And now this can be because of intra-abdominal adhesions, because of anastomotic strictures. It can usually a mechanical cause that leads to this. And the treatment is essentially bringing the patient in, putting an NG, giving them a bowel rest, and if it's a prolonged course, giving them TPN until they get better. But another option is trying elemental diet, and this can potentially be done as an outpatient, and this is the case that was done as an outpatient. And patient is functional out there, it's taking elemental diet, it gets absorbed at the proximal part of the small bowel, and getting all the nutrients that the patient needs, and slowly that gives a pseudo rest to the gut, and the patient improves. This obviously doesn't cure it because the underlying cause is still there, but at least patient doesn't need to be hospitalized, and saves the system and the patient a significant amount of time and cost. So I wanted to finish a little bit early so we have some time to discuss, but hopefully I convinced you that the success with elemental diet simply underlines how powerful diet can be in managing disorders, all the way from microbiome related disorders to inflammatory disorders to type 2 inflammatory disorders that can be helped with these diets. And they have one reason is that they have profound physiologic effects. They have anti-inflammatory effects. They modulate the microbiome. They are essentially allergen-free, and those are the ways that they assert their effects. And generally, especially with the palatable ones, the side effect profile are quite acceptable. And also they can be used not just as exclusive, they can be used as a replacement of a meal to help some of the chronic conditions. So with that, I'll stop and happy to answer questions.
Thank you, Dr. Rezaie. I don't believe, okay. I was making sure I wasn't muted. Thank you, Dr. Rezaie. That was a great presentation. You went through the entire paper without actually going through the paper, which was fantastic because it was a really long read this afternoon. So thank you for sharing the data of those individual studies for us. We had a question in the chat, and it was around reimbursement, because you mentioned that early on, that reimbursement was an issue. My understanding is that it is not a required thing. It's not an essential food that needs to be covered by insurance, but that it is gaining in support from insurance companies. Have you seen that in your clinic, that more people are able to get it today? And do you think that that is something that can be overcome?
Yeah, absolutely. So the access is an issue, but interesting enough, Europe, especially Scandinavian countries, enteral nutrition is covered. So there are examples outside of the US that it is covered. Um, in the US, obviously in the setting of Crohn's disease, so the headways are being made, and there are some systems that cover enteral nutrition. For example, I know Kaiser, for example, covers enteral nutrition, and some insurances are starting to cover enteral nutrition. This definitely is, we have a long way to go, but it's a big change from just even a few years ago. And I think that's just the awareness around the fact that some of the disorders can be managed successfully as an adjunct therapy or even the main therapy with diet. But again, this requires a lot of advocacy to sort of let insurance companies know that the role of the importance of diet and the coverage. Um, yeah, so it's just at this point, unfortunately, it's very tough. But things are definitely getting better, especially in the setting of IBD.
Fantastic. I know that IFFGD is a member of two different medical nutrition coalitions, and there's legislation that is currently being pursued in Washington. Unfortunately, it only covers certain disease states and not all, and it is restricted to only certain payers, not all. But it's a start. It's a start for us for sure, and hopefully we'll see more of that moving forward. So you mentioned that, and this is just for me. You mentioned that the palatability of elemental diets, they are powder forms that you would constitute with water and then drink.
Mhm.
If you're not doing it through enteral nutrition. And you said that the palatability since the 70s has really gotten better. How do they do that without adding any flavorings or sugars? I mean, how can you make amino acids taste better?
No,
How do you do that?
that's essentially the miracle of food engineering and flavor masking, as they call it. So it has come a long way. I mean, the joke is with some of the food engineers is that it has come to a point that they can make, if you put a blindfold, they can make a shoe that is palatable and you think you're eating food. So it's come a long way. The way it's done is that you can predict at what concentrations and how much different ingredients, when they're mixed together, the final products taste like what. And that's something that when you have like 70, 80 sort of like separate ingredients, like an elemental diet, it becomes impossible to figure out just by experiments. So you need predictive modeling to figure that out. And also flavor masking has come a long way. So that has sort of paved the way for the new diets to be more palatable. So I think that's very important. On the other side, there's also I see in the chat that you have to make sure that when they say it's elemental diet, it's truly elemental diet, because supervision on medical foods are not necessarily similar to pharma, uh, and they're not directly supervised except for baby formula by FDA. So you have to be careful where you go and what you look at.
And so as a consumer, let's say I decided that I wanted to do this meal supplementation and see if that helps with some of my GI symptoms. What would I be looking for in an elemental diet that would let me know that, you know, this is probably something that might be good for me? Or do I just try them until I find one that works?
Oh, no, no, I would definitely seek some medical help from like a healthcare provider that is in part
Hmm.
familiar with this, whether that is an MD or a dietitian that knows in what situation this can be helpful and in what dose, how many days, and how do you come off of the elemental diet. I didn't go into detail of that. For example, when you finish let's say 2 weeks of elemental diet, reintroduction of food is important, right? So because your body is used to liquid diet for 2 weeks, and now you want to reintroduce solid food. So you have to start the bland food for a day or two. For example, broth, chicken, sushi, beef, rice puree or something, or rice porridge. So and no spices. So because your body is not used to spice anymore. So it takes a few days for your body to come back. So somebody needs to kind of coach you through how these. They're good to help online, but I mean definitely I would recommend a healthcare provider to kind of like walk you through doing a course of elemental diet.
Fantastic. That's always good to remember when you're trying any diet therapies for any of your GI conditions or any medical condition, right? That you always work with your doctor and preferably also hand in hand with the dietitian. Remember, IFFGD has a dietitian listing on our website. If you need help finding a dietitian to help you with elemental diets, feel free to do that. I know that there are a lot that are available on Amazon and other ones as well. So making sure that you are looking at a good one. Are there ways, I know that in, you know, some different food stuffs or food items, there are like different grades where you can see if something has been actually clinically trialed, like in some of the studies you highlighted today, and then some may not. Is there any way for someone to know that, or should they just speak with a doctor or a nutritionist and get recommendations from them?
Yeah, definitely talk with the dietitians to see what data is behind each product. Obviously, look, you know, for example, in the field of elemental diet, for example, in the paper that we published, we mentioned what formulation is this, right? So there are, for example, I'll just gonna name them. For example, Y1X Plus is made by Nestle. So that's a well-known elemental diet. It's not necessarily palatable, but it is well studied, going back to 80s where it was developed. There is Elantal, which is mostly available in Europe and Japan. The palatable new one is Mbiota, which is the new formulation that was data behind them. So we have summarized which formulations have data behind them in that paper, which is actually open access, so everybody can access that sort of paper that and read to see what has data behind it, and probably if it's not on that list, what there's no data behind it. So so that would be helpful to choose what diet will be helpful for you.
So we have a question in the chat, and someone asked, how do you monitor nutritional adequacy during prolonged use, especially in patients with comorbidities?
Yeah, so that has been one of the limitations. Definitely there, when you want to go beyond 2 weeks, that's the time that you want to do it with healthcare provider, probably doing some blood work, make sure that you're not, you're taking enough of the nutrients that you need. So that's, for example, they have treated patients with Crohn's disease for 8 weeks, right? So these patients were monitored throughout uh, throughout the course of the clinical trial. So yes, definitely needs to be monitored, especially if you're going beyond, for example, 2 weeks. Now, if you're doing it as a supplement of one meal, the way that we do it in, for example, chronic pancreatitis or maintenance dosing in some patients with SIBO, that doesn't necessarily need monitoring because you're eating regular food for the other meals. So that's less of a concern. But just like any other sort of enteral nutrition, you need to monitor if you're going long term for sure.
Thank you so much. And actually it is 5:58, so we should go ahead and wrap up. Thank you so much for this interesting talk. Elemental diets are all the rage right now in nutrition conferences, and I attended the OLE conference this summer and saw a ton of the elemental nutrition companies there exhibiting, and it was definitely something that I know that is becoming more and more important to patients to try. They really want to try this diet just to see if it can help them. And so appreciate you explaining some of that and some of its benefits. I had not realized all the different GI disorders that can be treated with the elemental diet. And I hope that those of you joining us today also found this to be very informative, and appreciate everyone coming to join us in our the last journal club for 2025. Thank you, Dr. Rezaie, and everyone. Remember to log your 3,000 points in the wellness event so that you get credit for watching this presentation. Share this with a colleague. It will be on our YouTube channel tomorrow, and people who were unable to watch today can go online tomorrow to the YouTube channel and watch it and still get their points as well. So I appreciate everybody. We're halfway through the event, and the leaderboards are constantly moving around. So we're excited to see what's going to happen. I know that Cedars-Sinai is right now in #2 space for the academic institutions. And I know that Bianca Chang has been very active and really wants to take that title from Amol Sharma this year. You know, Ali, do you think you guys are going to be able to do it?
While I was on call, I haven't logged anything. I'll be more consistent. I'll do it. I'll do it. All right.
All right, fantastic. And I hope all of you guys are getting your stuff logged in the app. If you have any questions, any problems with the app or with the website, make sure that you contact Jamie Dumont. She's the one you've been receiving all these wonderful updates about. Ali mentioned that this article we covered today is open access. It is also, there was a link provided in the email that Jamie sent you this morning with the call-in and the login information. And the link to this particular journal club. So feel free to use that link to download this article to read it through yourself. And right now we are at 6 o'clock. So I appreciate everyone's time today. And thank you, Dr. Rezaie, for helping us better understand the elemental diet.
You're welcome. Anytime. All right. Thank you.
Good night, everybody, or good afternoon.